Yes, sir, please start now.
Hi, good afternoon to all. Good afternoon, Pal ma'am, and welcome to one of the webinars hosted by Indian Vedyas and Ananta Hemp Works. Firstly, I would like to thank Indian Vedyas for this opportunity and this platform, where we have been doing multiple sessions at various times, and we've been fortunate enough to get doctors like you onto this platform to talk about the hemp-based cure in different indications. And as we've been connected with Dr. Payal for a long time, and she's been working with us for a long time, today I would like to take the opportunity of picking through her brains a little bit and also asking her to present a certain case studies which she has been doing in her practice and also in her
Hello, Devesh. Hello, Vikram.
Ma'am, just waiting. He is joining again.
Sorry?
He is joining again.
Yeah, okay. ठीक.
Yes, interruption. Can you hear me?
Yeah.
Yes, sir. Yes, sir.
Yes.
Yes. Sorry for the interruption, but yes, I was I would like to continue. We want to welcome Dr. Payal Khandelwal on this platform and thanking Indian Vedyas once again for giving us this opportunity on this platform. Today we have Dr. Payal Khandelwal with us, and we will be talking on the topic of insomnia and anxiety. And she's been using Yes, sorry, ma'am. This platform is connecting and disconnecting again and again. Yes, finally asking again, ma'am. Can you hear me? I think it's connecting
Yes,
and disconnecting
I can
again.
hear you. Yeah.
Yes, yes. Sorry, so I'll just start with the introduction. We have Dr. Payal Khandelwal, who has done a graduation and post-graduation in Ayurveda from the prestigious Institute of Tilak Ayurveda Institute, Pune, and has worked for the past 15 years in the capacity of an Ayurveda consultant, research associate, and a lecturer. She has also been awarded the National Herbal Research Award by Madhya Pradesh government in recognition of her contribution to clinical research in the field of generalized anxiety disorders. She has worked with internationally recognized institutes like Ayurveda Rasayani, Pune Rasayani Biologics Private Limited, Pune Million Eyes Healthcare Technologies, FLRHT Bangalore, and Himalaya Drug Research Bangalore. I am the founder of Ayurveda First Center and Ayurveda Consciousness Living Community. Ayurveda First is the brainchild of Dr. Payal Khandelwal. She is the senior Ayurveda Panchkarma and Garbh Sanskar consultant in Ayurveda First. Various research-based protocols based on Ayurvedic principles are followed at Ayurveda First for treating chronic ailments, including Panchkarma and Rasayan therapies, for best results. Her expertise are in treating lifestyle chronic diseases, especially infertility, incipient management with Ayurveda, skin disorders, gastrointestinal tract disease and liver disorders, hormonal disorders, gynecological disorders, and women wellness, immunity and allergic conditions in children and adults both, anxiety, stress, and mental disorders, wellness and preventive health care with Prakriti diet consultation and Nadi Pariksha. Thank you, ma'am. Thank you for joining us today, and thank you for taking out the time to spend with us and talk about this disorder, and also talk about the hemp-based medicines which you have been using. I am very glad to be connected with you, and we have had a good relationship. We've been using our medicines and the same medicines for a long time. The idea to connect today and bring doctors onto this platform is simply but to create a knowledge data bank, and also to get your experience and your knowledge in Ayurveda to the other doctors and to other customers who are suffering from this problem, who have not been able to get a solution for this, and also doctors who are looking forward to use the hemp-based medicines but are not using them because of lack of knowledge or because of lack of availability of the data. Similarly, thanking Dr. Piyush Juneja and for the Indian Vedas platform to bring us together on this. Would like you to please introduce yourself, and then we can start our discussion and the topic which we have shared till now.
Yeah. Hello, everyone. It's a nice afternoon today, and thank you to Dr. Piyush Juneja and Indian Vedas platform, and to Vikram from Ananta Hemp for giving me this opportunity to speak and express my views on the use of hemp-based medicines. I have been associated with the company for a while now, and I think it's more than a year, around a year, sorry. And
Yes, ma'am.
we have been exclusively using the medicines for a long time now. And today I have come up with the understanding of, or let's say, hemp-based medicines through the point of view as an Ayurvedic practitioner as well, and how all the journey started and how it has helped me in my practice. So thank you once again. And as I've been introduced, I'm Dr. Payal Khandelwal. I've done my graduation and post-graduation in Dravya Guna, that is pharmacology from the prestigious Tilak Ayurved Mahavidyalaya. So let's begin with today's presentation. So today I'm going to talk about the topic which I have also researched on, that is generalized anxiety disorders and insomnia. First, let's not forget about the understanding of uh, Vijaya or cannabis. What are the references in Ayurveda and how it has been mentioned? So, if you see this herb, it has a lot of medical and spiritual significance. And the first ever reference was in Atharva Ved. It is considered among the five sacred plants because as a source of happiness, joy, and salvation. Now, why I would like to reiterate these points are because as also as a Dravyaguna practitioner, it gives me, it holds a lot of importance to understand the plant, the way it is expressed in the text, Ayurvedic text. Currently, this is placed under Schedule 1 in United Nations Convention on Psychotropic Substances and Schedule E1 under Ayurveda Medicine in Drugs and Cosmetic Act. It has originated from Amrita and it requires Shodhan. Shodhan is the detoxification procedure which has been mentioned in Ayurveda for all classical formulations where Vijaya or cannabis is used, it requires Shodhan. To give a little bit insight into its action, it's Ushnavirya, it's Tikshna Vyavai, that is bioavailability. How is the bioavailability even after, before digestion? It is very, very quick acting and it doesn't have to really, it can bypass the digestive system and act very fast. And Yogavahi, see, it has a synergistic action. Therefore, its bioavailability and efficacy is very high. It is mentioned in more than 50 diseases as per the classical Ayurvedic texts. Traditionally, Bhanga, that is now if we describe about the plant, which is called as Vijaya or Bhanga, that is Bhanga is made or Bhang, it is made from weakest and it is weakest and it is made from leaves. Ganja is made from flowers and charas, that is the resin that covers female flowers and it is the strongest part of this plant. Reference of morphology of Vijaya is also in Ananda Kanda. I think this is a very good reference. It's a book which is about Rasa Shastra and it's also one of the most important topics in Ayurveda because in today's world we need fast acting medicines which are more bioavailable and can act on various diseases. Other references in Sharangdhar Samhita, Rasatarangini, Bhav Prakash and Amarkosh. Now, to give a little bit of importance, why is synonym of Bhanga? See, this was the original way how each plant was described in the Ayurvedic text. Okay, that time morphology of the plant used to be described and it was way more descriptive and easy to remember and understand. So few examples here, I would just quickly read them. Shivamuli it's called because it is supposed to be mythologically originated from Lord Shiva. Vijaya, which is most commonly used even now, it means victory from 6 desires of the mind. Bhangi, that is, it treats tapatraya, that is three basic types of diseases. And ganja, which is why it is called because of the intoxication effects which it gives. Vimardini, processing, it is done by pounding because you have to actually pound and then process it. Traditionally, it was done like that. Divya, because it causes pleasure or exhilaration. Siddha, because it's a holy herb. A few more names, if you can see Siddhamuli, Manonmani, Madhudrava, Chidallada, and Pashupasha Vinashini. That is, if you see this one, I would like to say that restores health from non-human behavior. Now, why it must have been said like this? Because today we see a lot of cases of anxiety, depression, and so many symptoms you might see, aggressiveness, which is totally like in those days were mentioned as or would be categorized into something which is certainly not a right human behavior. So even the synonyms of the plants have such a lot of significance because they express the pharmacological actions of the herbs in a very detailed manner. Manonmani, that is, it accomplishes the problems of the mind. And Madhudrava, it stimulates the Shuddha Drava, I think, hormones, which is such beautifully mentioned because we see a lot of positive effects on the hormonal health also through this hemp-based medicines. Kalagni, because it provides victory from death, and Sarva Rogagni, that is cures all diseases. So here it might mean most of the diseases which are commonly seen in today's scenario. Moving ahead, properties of Vijaya, it is Tikta Katu, as we all know that it has a bitter and a little spicy taste. Lagu Tikshna, that is about how its activities are, its gunas. Virya Ushna, that is hot potency. Vipak is Katu, and Doshagnata, that is how it will act with on the mostly Vata and Kapha doshas it acts. Action is Grahi, Pachana, Deepana, Kamada. Kamad is aphrodisiac in nature, Vajikarna useful in infertility treatments, Tandra, Murcha, Moha, we can correlate it to the psychological symptoms. Nidra Janan, it does have an ability to give a good quality sleep. Karshini, Vyavai, Medhya. Vyavai, we have already spoken about bioavailability. Medhya, that is, it is something which can stimulate the higher intellectual functions of the brain. Vakvardhini, which will improve the speech. Mother, Sukham, Sattva, Yogavahi, and Rasayan. Now, all this have been given, Sukham, Sattva, all this because it actually gives pleasure to the senses. But at the same time, I feel for a doctor and as an Ayurveda doctor, the most important things which can be useful in practice is the Yoga Vahitva, or what we spoke about is the synergistic action and quick bioavailability, and Rasayan, that is the most important benefits that are the regenerative and immunomodulatory properties of the drug. How it is traditionally used is it's shodhan, that is detoxification is done in cow milk and cow ghee. And why was it done? Was to reduce the THC by 85%. We'll come to know what is all about THC. If you see the, sorry, so PPT visible. Yeah. So if you see, we have in all human beings, there is the endocannabinoid system, and the drug acts by connecting to this endocannabinoid system. The Vijaya leaf itself has Vijaya or cannabis. It has two important components, which is the THC, and THC is, I'll just mention what it means. If you can see in the slide also, it's the tetrahydrocannabinol, and then the CBD, that is the cannabinol, cannabinol. And what it helps is it connects to the various receptors in the body and activates the human endocannabinoid system. That's how its action is seen in the human body. So primarily the THC, it binds with the CB1 receptors in the body, which are present in the brain and the nervous system. And the CBD, on the other hand, and also one property about the THC is that it is a primary psychoactive component in which is present in the cannabis. And then the CBD, that is the another active component. It has no psychoactive effects, but it has been shown to have powerful anti-inflammatory and analgesic properties. And that's the exact reason why it gives such beautiful results when used in various chronic ailments. Moving ahead, how it works, if you see it, like already spoken, that there are various receptors in the body which it binds to, and it activates the human body immune system, and also works on various other functions which are described in further slides. If you can see the CB1 receptors, they are present in the photograph. If you see there, they're useful in motor activity, thinking, motor coordination, appetite, short-term memory, pain perception, and immune cells. And the CB2 receptors that target is the gut, kidneys, pancreas, adipose tissues, skeletal muscles, bones, eyes, tumors, reproductive system, immune system, respiratory tract, skin, CNS, CVS, and liver. Now, when any medicine, hemp-based medicine is taken, the important component of it, that is the CBD, will activate or will connect to these receptors and will show its pharmacological actions in the body. So the various diseases which are being mentioned in the Ayurvedic texts, I have put a list here to just correlate with what the modern science has also said. But if you can see, already a list of around 50 disorders were mentioned in the classical texts where Vijaya or cannabis was useful. In Agni Mandya, that is where digestive metabolism has weakened and the person doesn't feel hungry. So many diseases, we see this as a primary symptom, especially in chronic ailments, like even people who have undergone chemotherapy and are taking treatments for cancer, we see those having weak appetite. Then Pandu or can be correlated to anemia, rheumatic disorders, then epilepsy, other diseases like piles, rhinitis. So immune system related also, if we can talk. Let's see the various systems which are covered here. The renal calculi, then in also useful in menstrual disorders like menorrhagia, then in different osteoarthritis or different diseases of the skeletal system, and diarrhea. And most of these diseases I have used the hemp-based medicines and they have given wonderful results. Bhram, that is vertigo, then vomiting. If you take diseases related to the reproductive system, then even in impotency, it is good. Malabsorption syndrome, gut-related, or in premature ejaculation, again related to the infertility cases, we see so many nowadays are on rise. in tumors, hiccups, urticaria, old age, in colic pains, fever, edema, itching, hoarseness of voice. Then in diseases of the respiratory system, that is asthma, cold and cough. Again, coming back to menstrual disorders, leukorrhea, skin disorders like psoriasis, leukoderma, and in mental disorders, mental health disorders like insanity or depression, anxiety, we have already spoken about. Then tuberculosis and hyperlipidemia, various other disorders like set of urinary disorders, which we have already spoken. So in short, if I would categorize it, you can see a lot of our systems are covered in it, and from head to toe in various disorders, this medicines can be used wonderfully. Now, I would like to talk about my personal experiences in cases of generalized anxiety disorders. I've chosen this category because in my practice, since I deal with infertility issues, skin ailments, and various menstrual disorders, I find that generalized anxiety disorders, as the name suggests, there are, if you take the Hamilton anxiety rating scale, then 108 symptoms are mentioned under generalized anxiety disorders. And also during my post-graduation, I was the first one to design an Ayurvedic scale based on the symptoms given as per anxiety in our Ayurvedic text. And when both these scales were used in patients and we saw all the Ayurvedic medicines used, we see a lot of improvement in anxiety. But the truth is that around 70 to 75% of the patients who come to the clinic, they fit somewhere between mild to moderate anxiety. So if we do a survey or a research of of all the patients who are stepping into our clinic, and especially post COVID, we see that anxiety is on rise. And unfortunate thing is that most of the time people are not even aware about this. So if you go to the core of the issue, like I would quote with many examples where while talking to the patient who was suffering from erectile dysfunction, after going deep into the history, we came to know the actual reason was severe anxiety. So it was, I would say, in the scale of Hamilton anxiety rating scale, it was somewhere between 100 to 105. So if you can understand that how much a patient can go through a lot of anxiety issues, and the other physical symptoms would just be a reflection of that anxiety. So we need to find out what is the core issue. And as an Ayurveda doctor, our case taking actually helps us find out the real core issues and help them treat better. So let's go ahead and see. In all this generalized anxiety disorder, it is characterized by excessive or unrealistic anxiety about two or more aspects of life: work, social relationships, financial matters, etc., often accompanied by symptoms like palpitations, shortness of breath, dizziness, etc. In Ayurveda, like I just mentioned, it can be compared to chittodveg or chinta associated with disorders of rasayana and manovaha srotas. Rasava Srotas and Manova Srotas. It's not Rasayana. Contemporary management here was anxiolytic with ADR, and assessment of patient was done based upon Hamilton anxiety rating scales, like a scale I already mentioned that it has 108 symptoms as per modern parameters, and as per Ayurvedic self-assessment scale, which was designed by me, we could see a lot of improvement in the patients. Now let's proceed here. This is just the reference to my dissertation, that is comparative evaluation of Medhya effects of ashwagandha and shatavari in the management of GED. So this was in the year 2007. But if we continue with the research now, I find hemp-based medicines are very, very useful in this category of diseases. Now let's go for case one. This is an interesting case where a female aged 41 years, she was having hypertension and insomnia, and she was on 0.5 mg petrol. Now her symptoms were, especially around COVID, that anxiety about working in kitchen, and post-COVID fear of death and disease. She had seen some close family members' death, and she was traumatized. So she had severe anxiety even after taking medicines. She was not able to control that. Palpitation was more when she was at rest. She had body ache and constipation and unwanted thoughts in mind, persistent worry, and problem of focusing in any work. According to the Ayurveda diagnosis, her nadi was Pitta Pradhan, Mutra, Mala, you can see already she had bit constipation, which I had already mentioned, and she was not eating well. Prakriti was Pitta Vatanubandhi. Her menses were regular and there was little more bleeding. In the laboratory tests, she was showing raised prolactin levels. And according to me, the diagnosis was chittodveg or generalized anxiety disorder. So what was the Ayurvedic treatment protocol we followed? And I would like to mention here how both the medicines were useful. In the Ayurvedic treatment protocol, I gave her Chandraprabha, Shatabdi, Ashwagandha, Kamdudha, Pravalpishti and Avipattikar and recommended her Nasya also by oil. At the same time, medical cannabis tincture was started as an adjuvant therapy in the dose of 4 drops sublingual after dinner, 1 hour before bedtime. The dosage was 1000 milligram cannabinoids in 10 ml. It contains Vijaya leaf extract 10% and hemp seed oil 85%. The importance of giving tincture-based medicines is, in my practice, I felt that it is very, very easy to take. Patient can calibrate the dose exactly, and it's very convenient for the patient to take them even if they're traveling or, in their day-to-day life. So the convenient part is very, very important, and calibration of dose is important. So we just started with all these treatments, and also, she was advised certain lifestyle changes, mindfulness meditation, pranayam, yoga nidra, and 6 steps meditation was advised to the patient. So the dose was started on 24th April 2022 till 10th May 2022 when the next follow-up was taken. You can see the symptoms improvement. There was improvement in sleep, unwanted thoughts had reduced, palpitations had reduced, but focus was still not clear. Patient was definitely feeling better. Her family members had supported this, that they could see a lot of improvement in the patient's behavior. After that, 10th May to 28th May 2022, the next follow-up was taken on 28th May. We had seen that there was a lot of improvement in her sleep pattern and fear about unwanted things, that fear especially, or getting skeptical about things, anxiety about unknown was gradually improved, and willingness to work. Initially, she was not ready to do anything. Day-to-day activities had become a very big problem for her. But after the treatment, she had started showing interest and had also started following her hobby. On Hamilton Rating Anxiety Scale, parameters had improved like before. Like if you can see, anxious mood before treatment was 3, after treatment to 1. Tension before treatment 2, after treatment it had reduced to 1. Fear similarly before treatment 3, after treatment 2. And gastrointestinal symptoms 3 to 1. So these are the improvements which are seen on the scale as well. Proceeding to next case, I would say this was one of the best cases which was treated, and this was very initially when I had started working with hemp-based medicines, when I had seen the results. This was a male patient, 45 years old, and his present symptoms at time were dizziness, lethargy, low energy, anxiety before addressing meetings, and he was also at a senior post, he was designation, and it was very difficult because he was getting very anxious before addressing any meetings, which he could do easily before. Disturbed sleep, threatened feeling. He used to feel threatened, and didn't like anyone challenging his point of view. He was in a corporate lifestyle, worried about career and people's behavior in office in the past. He likes perfectionism and trauma after father's heart attack in 1998. So the patient approached me with these medications he was taking, 10 mg benzodiazepine since 20 years, and he wanted to stop it completely with Ayurvedic treatment. That was one thing, let's say, he had given me it as a challenge as well. Though I told him that let's see, I'm not very sure we will be able to completely stop the dosage because since 20 years he was dependent on it, but he was very much willing to do so. And he had given me a previous history that he had done some Panchakarma treatments in 2021 in Kerala and was very inspired by Ayurveda. So he really wanted to go ahead and try these treatments. His mala, that is motions, were irregular. He was sometimes constipated. Again, diagnosis Chittadvek, severe anxiety, GED. Now his treatment, what we gave was, we used Tagar, Brahmi, Jatamasi, Surasa, Kapikachu, Ashwagandha, Kamdudha and Raktapacha. Pratimarshan Asya, 3 drops of Panchendriya Vardhan oil. Medical cannabis was started as an adjuvant therapy in the dose of 4 drops sublingually after dinner, 1 hour before bedtime. Later, this dosage was increased to BD after around 8 days after starting the treatment, because it has to be gradually taken forward. And we were continuously observing him. So then lifestyle changes, pranayam, yoga nidra, and 3 sessions of access therapy were done. I'm also an access practitioner, so I had done this because a holistic approach was very, very important here. Um, so if you see the treatment, which was started on 15th April, and the next follow-up was taken on 4th May, patient managed to reduce benzodiazepine dose from 10 mg to 5 mg. Again, I mentioned the willingness of the patient was seen here because he was ready to do so, and we went slowly on tapering of the dosages. We just wanted to see how the patient would react. The anxiety had reduced with medicines and counseling, and lethargy had reduced, but headaches and low energy was still there. So he was complaining about headaches. So I introduced Kamdudha, 2 tablets BD for frequent headaches, which is I would say, a Pittagna medicine. And especially after sleeping during the daytime, he used to get more headaches. Then headaches got better. Then the next follow-up after 4th May was taken on 23rd May, and patient was determined for further reduction of dosages, reduced benzodiazepine gradually to 2.5 mg, but did not have dizziness and headache was there sometimes. So this was a very significant change, which I would like to note here, that it was amazing to see this, that we were confident enough to taper off his dosages. Meanwhile, cannabis and other Ayurvedic medicines continued. From 23rd May to current date, the patient's follow-up message he had given to me was, "Hey doctor, I'm doing well, managing the transition from benzo. It's 3 weeks now. I will post my comments or feedback on clinic profile. Thanks." Now, this was when we spoke to him. After that, patient is currently doing very well. I mean, this was last year when I had taken his case history. His Google review has been posted on our profile on Ayurveda First, if you want to have a look at it. The patient is currently doing very well. Anxiety before meetings has completely gone. Focus in work improved, and headache, dizziness, energy levels are much better. And almost towards the end of May, or I think it was around mid-June, that all his medications, benzodiazepine dose had completely stopped, even from 2.5 mg to nil. Now the patient is not taking any medications, not even Ayurvedic medications. In fact, we could stop all his medications by the end of June. So, and he was able to. Now it's almost 1 year, I would say close to 1 year. He stays in the same community as I do, so I can see him, I can observe him. There's a good interaction, and he has been very, very happy. And he told me, in fact, he went on with the idea that let's, start a mental health clinic in Ayurveda. That was his motivation around this whole treatment protocol. So this is one of the best success stories, I would say, with a combination treatment. And I think here cannabis medicines do hold their due credit, because it would not be so easy to get him off his benzodiazepines otherwise. So let's proceed ahead. Case 3, this is the male, age 43 years, and it was referred to me by the same patient whose case we discussed. The relationship, they were brother-in-laws. Now, his current symptoms that time were irritation, mood swings, lack of appetite, lack of sleep, sweating in palms, concern about family members, not happy with monotonous job in car company, work-related anxiety, Monday blues, and never has any feeling of hunger. He actually mentioned that, "Doctor, I don't ever feel hungry." It was very strange. I kept on asking him, but he said, "No, I never feel hungry." That whole appreciation about hunger, that feeling itself had disappeared. A lot of anxiety about kids' homework and their being outside. He used to wake up at 2:30 a.m. and couldn't sleep again. And he was taking sleeping pills like Zolfresh or 10 mg, and he was on antidepressants when he came to me, and he did have constipation, history of fissures. Again, his Prakriti was Pitta Pradhan. The treatment protocol followed was Kamdudha, Jatamausi, Brahmi, Nakeshar, Ashwagandha, Arogyavardhini, Aragvad, and Shatavari for his all symptoms to be managed. And Pratimarshan Asya we do follow very religiously in all these cases. 3 drops were given at night time. Pranayam, left nostril breathing, mindfulness meditation exercises were started. I told him to start with a gratitude journal and write down the anxiety triggers as well. Medical cannabis was started as an adjuvant therapy at night, 4 drops at sublingual 1 hour before bedtime after dinner. After sensitization for a week, dose could be increased to BD, that is twice a day, and the combination of 3000 mg cannabis leaf extract in 10 ml that was started. Treatment was started on 23rd of April, and the first follow-up was on 9th May. Patient saw improvement in sleep, although continued sleeping pills and antidepressants. He was a little bit more worried. He didn't want to leave off immediately or start on tapering dosages, so we were fine with it. His focus and energy levels had improved, and anxiety related to kids and family health or financial concerns had reduced. The next follow-up was on June 2nd, and he had stopped his sleeping pills completely by himself and was getting good sleep. Actually, he told me the transition. This was very important for me because initially, the first follow up, he was not much willing to do so. He had the anxiety around stopping sleeping pills. But after counseling during that follow up, he was ready and he did agree to do it and see what happens. And he was able to stop his sleeping pills by 2nd of June. All his symptoms had started improving, and he had left his job previously and was not able to focus on new job. But after the above treatment protocol, his zeal to work had come back. So the thing was, he was working in a car company earlier, and then he found his new interest in a real estate business. After that, I couldn't take much follow-ups with the patient because he was traveling and he was not able to connect to me. But so I had only 2 follow-ups with this patient where already we saw improvement in his symptoms. Case 4, this is also a very important case according to me because this patient was suffering for a long time. He had insomnia and depression and was on allopathic anxiolytics, antidepressants, and on sleep medication. He had approached us at Ayurveda first to treat him for anxiety, insomnia, restlessness, lack of focus and energy, unwanted thoughts, and continuous anxious feelings regarding work and career. He had stopped taking allopathic medicines on his own when he had approached to us, but was suffering from severe anxiety and insomnia and acidity. He could not sleep for more than 3 to 4 hours at night. So you can imagine his condition. And during that phase, he also lost his father, so the anxiety had gone way up. His prakriti was Pitta Pradhan again. Since the severity of symptoms were more, patient was advised Panchakarma treatments like Virechana, Abhyanga, Shirodhara, and Nasya. Daily Yog Nidra, Pranayam, counseling, access therapy, mindfulness meditation was conducted in clinic, and he was advised to read spiritual texts because he could feel the connection to it. Medical cannabis oral tincture started with 4 drops and then was increased to 5 drops sublingual. Cannabis leaf extract 3000 mg per 10 ml was the dose given. First month, we saw that sleep pattern improved considerably, but patient woke up in between and he was still able to fall asleep again. He was still waking up. There was disturbed sleep, but there was still an improvement, and his energy levels had increased, and he had started walking up to 7 to 8 kilometer daily, which he was not able to do initially. In between, he again used to slide into anxiety because he slid into anxiety because of his father's death, but had recovered well after some time. On and off symptoms of anxiety, lack of focus, lethargy kept on happening, but he's still undergoing treatment since past 4 months and is doing well. His Google review, as mentioned on our profile, was I'm fully contented about the consultation and medication. So he's still in touch with us, and now he's just, he comes to our clinic for Abhyanga or Shirodhara. No internal medicines are given to him, and he's able to focus on his work. He's back to his regular routine. So I'm happy about whatever results we have seen in all these cases because this is a debilitating condition where people actually aren't able to carry on their day-to-day life activities, and they're driven to, lot of psychotic medicines. They don't know how to proceed ahead. They have lost all hopes in life. So somewhere down, all these medicines do help them to take care, and I would say in the most natural way. Of course, at times like we have to be careful with these medications, the hemp based, because we have to monitor them closely. But in my last 1 year journey, and thanks to Ananta Hemp and Vikram, I would like to share this on the platform that we have not seen any untoward effect on our patients, and that is the first thing which has built up a lot of confidence while practicing these medicines. Some of the cases which I have not mentioned here, but I have personally shared with Ananta also, and I just wanted to mention here that these hemp-based medicines beautifully work in pain relief, because one of our patients and their family doctor, I can say, and he had approached me for a different reason. We treated him for a different reason. After getting successful results there, one day he casually mentioned that, Doc, I've been suffering like anything for last 10-15 years. I have severe pain in my, I have this cervical spondylosis and I have severe pain, radiating pain. And no matter what, I take a lot of painkillers on and off, but I don't get good relief. And he was staying very far off, like around 20-25 kilometers from my clinic, so I couldn't really call him for a panchakarma therapy. So I just put him on a very basic Trayodashang Gugulu, and I told him to take the pain relief medication, hemp-based medicine. And I almost forgot about this incident. After a week or so, he called me up and he told me, doctor, what did you give to me this time? There was a different medicine which you had given, and I was a little amused. I said, okay, let me just check. I don't know why you're asking like that. And he told me because the capsules that he had been given had really very nicely helped, and he said that for the first time in so many years, he could sleep peacefully and did not feel any pain. So he has been, and after that, he got his mother-in-law, and then so many patients he has referred for who had this chronic pain, especially related to musculoskeletal system. So there are such wonderful experiences, and I can tell them because in these patients I had not used much other medicines as such. But if we see, there is a synergistic action also in most of the cases when we treat. So if you choose it separately or you choose it as a combination therapy, hemp-based medicines definitely can boost our practice in so many beautiful ways, because people are looking up to us to solve so many health issues. And another area which I couldn't mention in the cases here, I have seen some very good results in, I would say, erectile dysfunction cases and also IBS. So these, and also in PCOD, definitely. So where there is, or cases of adenomyosis or endometriosis, where there is severe pain and patients are on painkillers all the time. So we do administer them this as a plant-based substitute, and they're more than happy. And most of them have told us about the promising results they have got through usage of hemp-based medicines. So I think that's for today. I have shared all my experiences, what I had, and my journey as a hemp-based practitioner for last 1 year, and how I felt about it. So thank you again to everyone, and a big thanks to Ananta Hemp and Indian Vedyas for letting me share my views here on this platform.
Thank you so much, ma'am. And this is your experience only in cases like this. So this only which gives us all the confidence and all the courage to move forward and keep on making this medicine. And as we are connecting with so many doctors now, even our company experience says that the maximum results which we are seeing are actually in lifestyle disorders and in pain management.
Yes.
There's certain questions which we keep on coming to us, and we would like to ask you the same thing around
Yes.
anxiety and insomnia. We'll
Yeah.
keep pain management for another session when we can talk about it in detail. Um,
Sure.
One thing which even doctors ask us and customers ask us is when somebody is being diagnosed with anxiety, how do you
Yes.
really diagnose a person? When do you say that anxiety has turned from anxiety to anxiety disorder? And now that
Yes.
this person needs to be treated for anxiety, because a
Yes.
lot of doctors have this opinion, and I've also been reading about this chapter, that basic anxiety actually is a very natural emotion for us, and it's a very important function for the human body. If you will
True. True.
not have normal anxiety, and if you will not have anxiety at all, actually you'll be categorized as a psychopath. And anxiety also triggers our flight and fight response, and
Correct.
in older times it used to let us scan the environment for
Yes.
threats and everything. So how do you diagnose a person that, okay, that he's crossed the line of from anxiety, and now he has anxiety disorder, and now it needs to be
Sure.
controlled and it needs to be.
Sure. So first and foremost, I would say if for a beginner, if it is difficult, because sometimes symptoms are very overlapping, and it becomes difficult to understand the thin line when they've crossed. So with my experience, I would say that the first and foremost easiest way is to give them the scales. When they're sitting in your OPD and you have some waiting time, it's better if you have the slightest doubt. Either the person approaches us with the anxiety issue, or we can, if we have we feel that he might be suffering from from anxiety, then the first and foremost step we should take to get a proper understanding is to hand over the standard scales. So they can use the Hamilton anxiety rating scale, which is easily available on the internet. Just take a print and just hand it over to the patient. It takes around 10 minutes to go through the scale, and you can completely and easily get a understanding whether the patient stands in mild to moderate anxiety or moderate to severe anxiety bracket. So this is one of the I would say objective parameter also, where we can actually study and it remains with us. Second way, or you can use an Ayurvedic scale, which I said that I had designed, and it is available in the local language also. This is one of the way to understand. The second understanding, which I say, because is the way I ask patients is, I put them under three categories. I would say it's a practical solution because it becomes easy for the people to understand. So I ask them whether, if I put you into three categories, when they say that I have stress, okay, because people will generally use words like stress, anxiety, depression very loosely. They don't understand,
Yes.
So I ask them things, first of all, what symptoms you're going through, whether you can sleep peacefully or not, or do you have disturbed sleep, do you wake up quite often, or do you feel there are a lot of unwanted thoughts, or if continuously the person is thinking about a lot of things, cannot focus on his work. So something, this is not normal. Of course we should have anxiety, that's our the flight and fight mode, everything I understand. But if it is crossing the line, this is actually crossing the line when the person does feel that he or she needs help. When they say they have lost focus, they are unable to understand. Sorry. So they are unable to understand, uh, or or they have lost control over their thought process. They are not able to make decisions clearly. They are not able to sleep properly, or they have lost interest in meeting friends, active, social interactions. So many things they will tell you, which we feel. Of course, if you have a doubt, you can ask their family members. So most of the times, patients are accompanied by their family members. You can cross confirm. You can confirm again with them that. Do you feel that there are changes, and in some or the other way they want to support what the patient is going to say. So quickly, first thing we should register that this doesn't look normal to me. At least this we can understand. It looks normal or it doesn't look normal. The next question, again for confirmation, what I do is I ask them that, okay, I'll give you three options and I will tell you whether you will be able to control this on your own. Do you think you need help here? That is stage one, where if I tell you a bit simple exercises and you think you can manage it on your own. Second is, you'll need little bit medicinal help. Do you feel that way, that will help you? Or third is, do you need much more help? Do you think that you cannot absolutely manage it by your own self? So if you ask these questions, leading questions, definitely they will tell you that, no, doctor, I feel I will need medicines because I have tried many things. Most of them tell me that I've tried meditation, I've tried yoga, I've done counseling, but I don't feel any changes are happening. I just cannot do my normal life, day-to-day life activities. Some might say that I think medicines should be fine for now. I don't want to go for any other therapies or counseling. And some may say that absolutely they don't have any control over the situation. So it's actually, through the entire case history, which is very important. If you take, like I told you the good example, which I found that a patient had come to me with a problem of ED, erectile dysfunction, and he told me that my lifestyle is absolutely very good. I have no stress whatsoever, and I do all my exercises properly, but still I don't know why I have this problem. Now, this is a person who is a physically well-built person, age around 40, 41, and he was very, very confident while speaking to me. And I was just wondering, he didn't have any underlying comorbidities, nothing. And then I just dug up in the history, and you won't believe, in another 10 minutes after I started asking him, he started crying. He sat there and he was crying because he told me that nobody ever asked me before. 1 year ago, he lost one of his dear ones. I don't know whose death it was, but I know that it was something which has affected. And then he could correlate that, yes, after that only, after a month of this episode, I started feeling this problem of ED. Before that, I never had it. So now you can understand that where the history can go down. Yeah, the true root cause. So actually talking to the patient helps. We just need a peaceful 5 to 10 minutes to understand the situation. The patient guides us properly. Otherwise, you can simply anxiety rating scale and find it out for yourself. So I think that's the way.
So what we understand is that initially that you have to judge it from a patient point of view, that even if he's able to control it or help himself, And if all those
Yes.
helps have been given to him and he's already tried that, then some medicine
Yes.
intervention is required in terms of
Definitely.
anxiety. And if medicines also do not work, then maybe a combination and probably some
Yes.
psychiatric help will be required to treat
Yes.
that. And I'm
Yes.
sure that you must have seen these cases rise post COVID, and we have seen
Yes.
that, and we've seen that with all the doctors.
Yes.
So this is a problem which
Unfortunately,
is, yes,
yeah.
increasing every
Unfortunately,
day.
in
Yes,
children as well, adolescents and
yes.
children alike.
I was just about to say that like you
Yeah.
already mentioned, that this term has been used so loosely that I've seen
Yes.
school students now and people just using the word anxiety and stress as if having it is a problem. And the
Yes.
moment they feel uncomfortable, only they take it to anxiety level and they're seeking help for it. So I
Yes.
understand, and that is the main point, to differentiate between a normal anxiety and anxiety disorder. So that's something
Yes.
which we also get asked questions a lot. And the second thing we also get asked about insomnia is that a lot of people are using stuff like herbal melatonins, and so you're
Yes.
using different stuff to induce sleep in that. So how and my understanding in terms of using hemp is that if you're treating yourself with melatonin or other sleep inducers, what happens is it creates a dependency. And
Yes.
it creates a dependency that brain starts telling you that, okay, you're getting melatonin from outside, so why do you need to produce it? So,
Correct.
but
Yeah.
in medications like hemp, and correct me if I'm wrong on this, that when you use this medication, it empowers you to sleep, it increases the sleep-induced state, but obviously it is letting your brain use normal function. So, does it
Yes.
create a dependency in a long-term scenario? And when you treat it for insomnia, do you treat the patient, increase his dose, and then taper him off, or how is it uh,
Yeah.
better than let's say using a sleeping pill?
Yeah, so like I mentioned in the previous cases, what I've seen is whenever they have come to us with any drug dependency. In fact, today morning itself, I had a classic case of insomnia post breast cancer, and she's not able to. She said that like for 2 months I haven't slept, in spite of taking Zolfresh. So now she happened to increase her dose. So the dose dependency is one big trouble, and
Yes.
even her consultant told her that this is not fine. You cannot just keep on increasing the dosages. So what I want to tell here is, in case when I have used wherever I've used hemp-based medicines, I've seen that first I did not see any kind of dependency happening. To test this, actually, I had told one of our patients to stop it for certain period of time. When they were able to manage their sleep, I told them to give a break for at least a week and just to observe. Of course, we had continued with the Ayurvedic medications, but on purpose, I had kept cannabis away, and we saw that they had no issues or no challenges in sleeping after that. Second thing is, about dependency, I feel that at least in my practice, I haven't seen anything as of now, because patients have never been dependent on all these medications or the what we have given. When we tell them to stop, they're happily stopping it, and after that they are being able to maintain that kind of lifestyle and get the results consistently without any much problems here. Third thing is, if you feel that you might need, to give it for a little longer time, it's okay. There is no problem. The dosages can be adjusted from OD to BD, and then we can inform the patients that at some point you need to, before, it's better if we tell them beforehand about this drug dependency, because the most important question your patient is going to ask is this only, that doctor, will it create a dependency? So if you start using it yourself, you will see that actually there is no dependency needed on any of the hemp-based medicines. And if we tell them to stop it, the best way to convince them is to tell them that okay, for now I'm advising you to take this medicines for certain period of time, and then we'll give you a week off. Let's say a week off when you will not be taking these medicines, and you can find it for yourself. In fact, at times I've told them that go ahead and you can try and test for yourself whether if you don't take these medicines, do you get any withdrawal symptoms as well. And that gives them pretty much confidence about taking the medicines. They are very happy that okay, the doctor has told us already, so then we can definitely try this and see. And at least I don't know about, I cannot comment in general, but I definitely know that in my practice I have not seen a single case of dependency happening on the medication. So
Great, great. Yes, this has been our experience also, ma'am, and
yes.
this has been generally in some cases the doctors have tapered off the doses and even got
Yeah.
the patients off the medication
Yes.
completely in cannabis. And also on the second hand, there are certain cases where the doctor has kept them on, but it is a comparison between a curative medicine. You can't cure a
Yes.
problem, but yes, it's a
Yes.
management issue. So you can manage the problem, and when we have to
Yes.
manage it, especially in long term, when a patient is required this medicine. So because it does not have any side effects, it's a plant-based complete medicine. It's a better medicine to be on
Yes.
than to be on any other chemical-based medicine, which has issues going forward. So we have also
Yes.
seen that, and we will talk about pain management next time, because that is one area where we've also seen very good results.
Yes.
I'm not going to
True.
take more of your time. I think we've already exceeded our time limit. I would like to thank you once again of giving your time and your valuable inputs on this. We would love to connect with you again on a different topic on this, and we can go into the details of the other topic
Thank you so much.
next time. Thank you so much, ma'am.
Okay.
Thank you so much for your time, and I will connect with you very soon. Thank
Thank
you,
you.
and thank
Thank
you once
you.
again, Aditya and Rajesh, for connecting us on this platform. Thank you.
Thank you.